Pritha, you can start now. Its recording is on.
Okay. So, good evening and warm welcome everyone to this webinar organized by Kolkata chapter of IAPEN on Beat Constipation with Better Gut Health. I am Pritha Bose, a former dietitian of Manipal Hospital, Ranchi, and an IAPN life member of Ranchi chapter. I want to start today's discussion with a quote that says, "The road to health is paved with good intestines." And we often say that health begins in the stomach, and science definitely agrees with that. So, constipation is a silent condition which is affecting millions, but the good news is that it is not unbeatable. Today, we have an excellent chairperson and amazing speakers who will enlighten us throughout this topic. I would like to take the honor to introduce our chairperson, Ms. Mrs. Anindita Mandal ma'am. I would just take few minutes to share her introduction slide. Anindita Mandal ma'am has over 17 years of experience in our field, and she has been currently chosen to be the executive committee member of IAPE and Kolkata chapter. She has worked with many renowned hospitals like Woodland Hospital. She is attached with eminent diabetologists. She is a diabetes educator and NDEP class course instructor and a faculty member in Kolkata. She is an advanced bariatric surgery dietitian. She is a lifestyle coach as well and has achieved degrees from Florida University. And she has also appeared as a speaker for geriatric population regarding geriatric nutrition. I welcome you, ma'am, to take the session ahead. We are honored to have you with us.
Thank you, Preetha. Thank you so much. Hi, dear. Good evening, all. And this is a very good evening, and I am thankful to IAPEN because this year I got that opportunity to become an EC member in Kolkata chapter from IAPEN. And I'm very much thankful and feeling blessed to be here as a chairperson. And because we got that opportunity with this IPEN, and we can show our talent and we can share our knowledge over here, and we can work together basically and in this nutrition field, and here we can do something for betterment of our surrounding and our nation, of course. So in this manner today, this platform we create to discuss a very simple and neglected topic and the starting of the winter. Yes, we are talking about the constipation. So it is very much neglected and very much common. And it's being common from the childhood to adult age also because of the wrong food habits and the wrong behavioral habits also. So if we neglect this, and then it can be a serious and dangerous problems. Generally, people are facing a lot of problems like that: abdominal cramps, headache, vomiting, heaviness, less energetic. And of course, after that, it can be pies, fissure, fistula. It's a surgical issues, and even the colon problems, colon cancer, and even some metabolic problems they are facing. It can be overweight, and it can be underweight also, and some vitamins deficiency also. So I would like to introduce Jyoti and the dietitian Deblina, rather introduce a bigger introduction. So I just wanted to share their achievement, and they are the eminent speaker today. So please show me Jyoti's achievements slide so I can share something about Jyoti.
Pritha, Jyoti slide need to be shared, and if you can make it full screen.
Yes, sir. I have made it full screen and
No, it is not coming. You directly go back and share, because when you have shared the screen, now you shared entire screen. You stop share and share entire screen.
Okay. My screen is visible?
Not yet.
No.
Now is it okay?
Now it is
Yeah.
perfect.
Yeah. So Ms.Jyoti Pachisia, she's a lecturer, consulting dietitians, and content writer, and certified diabetic educators, of course. She did BSc, MSc, PG diploma in dietetics and applied nutrition from J.D. Institute, and certified diabetic educator course from NDP, completed certifications on renal nutrition from FST and Explorations Foundations, and formerly acted in Genesis Hospital, Koshba, special lecturer at Institute of the Gokhale Memorial Girls College, Kolkata, faculty at Navaset Institute of Nutrition and Dietetics, Ghaziabad. They're doing this online course, and nutrition and diet experts at NutrioTalk and Parentune, content writer at being theparent.com, and presented and published certified scientific papers, and lifetime members of the NSI, IAPEN, Kolkata, and FSTN, facilitated as dietitians awarded by the Indian Women Global Award, and felicitated as young researcher and by Institute of the Scholars, and felicitated as young faculty awarded by the FSTN Explorations Foundations, August from 2023. Can I see the dietitian Jyoti? And after that, there's Debolina. Please show me the Debolina's slide.
It's not changing, right?
Yes, sir.
Yes, yes. Now it is visible. Okay.
Yeah, and yeah, Deblina did 15 years plus experience she has as a senior clinical consultant in Suraksha Polyclinic, and presently associated as a dietitian and dietetic educators with the Suraksha Polyclinic and the faculty of NutriWorld, formerly associated as a faculty in Gokhale Memorial College, Sugar Feed, and with many projects on women's and child health by organizations like Abbott and GSK, awarded as Best Young Dietitians Award by FSTN. She has worked with many diabetologists of Kolkata and was associated with Suraksha Diabetic Clinic projects. She has presented lecture in Science Congress for Kolkata chapter. She has published international review papers on autism and presently working as a ketogenic diet faculty with NutriWorld. Apart from this, she has published many review papers on functional food and its role in non-communicable diseases. Content writers with THIP Media. She is presently pursuing research work in domain nutritional biochemistry and dietary intervention. She has peer-reviewed papers in journals in metabolic diseases and dietary interventions. She has received first prize in abstract presentations in Onco Nutricon Health in 2025 on topic of dietary interventions in hepatocellular carcinoma. She is an honorary member of All India Diabetic Associations and state topper in clinical nutrition and dietetics in 2008, followed by the second topper in Masters in Food Processing and Nutrition Science from IIST, Shibpur, West Bengal. So welcome Jyoti and welcome Deblina. We all eager to hear from your mouth.
Thank you so much, ma'am, for your warm introduction. Hello to everyone present out here. It's my immense pleasure. Rather, it's our immense pleasure to present our certain insights. And so let's not waste our time and begin the session. So today we're going to learn something new, something old, which we have forgotten also, but giving us ourselves a gentle reminder to heal your gut naturally. Now, India, if we talk about a country which has a rich cultural heritage of prioritizing health and wellness through traditional practices and dietary habits. And one such aspect of health that has gained significantly attention in recent years is about the gut health. The gut, which is often referred as the second brain, plays a crucial role in our overall well being. Many researchers have even stated that this healthy gut microbiome is essential for proper digestion, immune function, and even in the mental health as well. If you see in this one, there is a one research paper which was published in the year 2024, where they have literally, the researchers have declared gut microbiota as an endocrine organ. And trust me, it is not like we cannot say that this is absolutely wrong. This is actually true, because gut microbiota is known to perform many other functions. It functions like a metabolic powerhouse. And if we look into this diagram, that how it is doing it, so gut microbiota is known to metabolize carbohydrates in order to producing short chain fatty acids, right? And these short chain fatty acids like acetate, then butyrate, propionate, they are known to impact and regulate glucose processing, energy regulation, immune responses, and inflammatory processes. Now with this, when they are interacting or you are doing this, like in this interaction with the L cells via the GPR 41 by 43 also. Gut microbes are also known to produce our very own neurotransmitters, which are known in alternations in intestinal immune regulation, also modifying the gut motility while also helping in cognitive and behavioral shifts as well. But what if this is getting irregulated or disbalanced? Yes, it is quite possible. So this can be even a triggering or a signal which is inviting for many consequences. As you can see out here, imbalance or disruption in the gut flora can lead to not just the constipation but several other disorders also. And today we are coming across that how the disturbances in the gut microflora can lead to several other form of the NCDs as well. So due to, and this is again triggered due to several factors, of which the most common one being seen as poor dietary patterns, excessive use of the antibiotics, is sometimes again over intake or not getting a proper knowledge of using and many various medicines which is recommended for certain diseases. And the fourth, which is the most triggering point, is the stress. So let's have a look that how these four pointers, how these four factors can be equal, fair enough to trigger and result in the something really disturbing consequences, and of which the constipation is one of them. If we talk about the stress, stress is nowadays has become like a part of the thing. जैसे कि we talk ना, roti kapda और makan. Now the thing has changed. It has, the trend has come like roti kapda makan smartphone. उसके साथ there is an icing on the cake is the stress. So yes, be it India or be it worldwide, stress has become like a part of the thing. And according to this article, which is published as a review paper in the gastroenterology and hepatology, they have actually found out several ways that how this stress can cause constipation and its related disorders. So if I talk about in during stressful conditions, like there is something mishappening in the house or maybe some mishap has happened, body's adrenal glands releases a hormone which is known as the epinephrine, and this epinephrine is known to play fight or flight response. And this causes the body to divert blood flow from the intestine towards the vital organs like heart, lungs, brain, and which as a result slows down the intestinal movement, and in this way constipation occurs. Likewise, there are several other ways through which the stress can cause constipation. Like if I talk about that, it can cause increased intestinal permeability, which will allow the inflammatory compounds to be, invited, settle down in the intestine, which can lead to a feeling of abdominal fullness, which is again one of the most common you can say complaint or a problem among the people who struggle with the constipation. Even stress can also affect the normal healthy bacteria in the gut. And though various theories have not confirmed this, but many has been seeing this, that this can stress may reduce the number of the healthy gut bacteria in the body also. Antibiotics, as I was talking about, we have been hearing could be it's like fever is there or it's like mild something, we take up the pop up the antibiotics. We are having headache, migraine ka antibiotics le liya, finished. But do you know that if you are taking this antibiotics in excess amount, it can trigger difficulties to pass stools, and as a result you may declared as a constipated as well? Yes, it is possible. In fact, antibiotics are being linked to a higher risk of the conditions like clostridium difficile infection, and which can be a contributing factor to the development of the irritable bowel syndrome. Not only this, this resulting imbalance or the dysbiosis, which we're going to come across in the next few slides, it can affect the production of the necessary enzymes and impair proper digestion, of course. And in this way, it will slow down the bowel movement, cause dehydration, and several anything more. This is another a classic example of like antibiotic drugs, which even which if again if you're not if you are not maintaining your gut microbiota properly with the proper healthy patterns like dietary patterns, and if this is not coupled together, then it can negatively impact the diabetes management. You can see out here, it's actually showing that how it can decrease the the gallbladder motility and hypomotility, pylospasm, which can result in the gastric stasis, bezoars, dyspepsia, and many more of this. So, in India, in the recent time, if you all have come across in the news, recently a survey was conducted in the year 2020, between 2023 and 2024, and in that India has been declared one of those countries which has big four gut diseases. And it is so shocking that today this gut diseases is considered as one of the leading deaths in India as well. India has the higher average stool weight a day than those in the Western countries, and higher average stool frequency considered maybe as a healthy again, but again for sometimes the weight which is considered like higher than that, it is again sometimes pointed out towards the something else as well. In fact, there is also been said that gut microbes in rural India have been found to be more healthier, more diverse than the urban areas. And today, because of this gut dysbiosis, this gut problem, we can see along with the constipation, so many other hormonal disorders, liver problems, respiratory problems are also getting attached with. So what is dysbiosis? Dysbiosis is again an imbalance, if we talk about, which can lead to inflammatory responses in the enteric nervous system, which can further even affect the intestinal motility. And that is why this particular thing has become one of the reasons for the weakened intestinal motility. In patients with constipation, the increase in harmful bacteria in the gut may stimulate the immune system so badly that it can lead to release of more of the inflammatory factors, which in turn exacerbate the constipation symptoms. Now, to understand more about the constipation and all, I would like to now give the handover to Deblina ma'am, who's going to give you more insights on it. Over to you, Deblina ma'am.
Thank you so much, Jyoti ma'am, for making the baseline for constipation. And like today, I would try to do as much justice as I can do with this short span of time with constipation physiology, what are can be like pros and cons and dietary management. Okay, all the spheres. But before going into like what I am going to discuss, assume the picture of the escalator of the metro station the staircase, and assume a person standing there. The person have to go towards the door. The skeleton is moving. The skeleton is moving at its own pace. And the person is also going with the same pace. Just relate the same condition with our colon. There is a natural peristaltic movement. What happens? Erokom erokom hote thake na, and that is how the stool gets evacuated from the body. And the person, that is the stool. Now, without understanding the cause and the type of constipation, the medical nutrition therapy, what we are supposed to give, can be a little diverted. So understanding the root cause is very important, and that is how I will start with the slide. So first, understand what is constipation. Now, constipation, for many people, they can say, আজকে সকালে পেট পরিষ্কার হয়নি. Okay, I will be available in Bengali, Hindi, English, 3 of the languages. And
Kindly keep in Hindi and English, please.
okay, sir.
Because from all India, people have joined.
Okay. So, सुबह सुबह क्या होता है, बहुत पेशेंट्स जब हम लोग जाते हैं, लाइक सुबह के टाइम पे पेशेंट्स आके बोलते हैं पेट साफ नहीं हुआ, कॉन्स्टिपेशन हो गया है. So at that point of time, we need to understand it is not constipation. At the same time, we need to make them understand there is a specific criteria that I will come later on. There is a Roma 3 index criteria, according to which there should be 2 eligibility criteria matched for that particular person to be called as constipated. ऐसा नहीं होगा कि आज साफ नहीं फील हो रहा या और 2-3 बार जाने के बाद साफ फील हुआ, मतलब ये कॉन्स्टिपेशन नहीं है. तो कॉन्स्टिपेशन क्या है? वीक में 3 बारी से ज्यादा you are not evacuating your bowel, or the size of the lumps are very big, or it's painful. So there is a criteria. I have shared that in the slide as well. I will come to that later. But एक मोटा मोटा समझने के लिए 3 बार से ज्यादा bowel evacuate नहीं हो रहा है, that is constipation. Coming to the bifurcation, primary and secondary. And primary क्या है? Primary वो चीज होता है जहां पे हमारा peristaltic movement is not going with the pace, and due to that the slow transit of the constipation is happening, or the outlet obstruction. Now understand here one thing, slow transit constipation, ये एक term लिखा हुआ है, but to be honest the bowel movement can be slowed down due to n number of reasons. Like right now Jyoti ma'am said, there is a psychological issue, there is a hormonal issue, and we will also discuss the physical activity issue. There is comorbidity issue, sleep cycle issue, बहुत सारे, मतलब there are a lot of things. Sure ma'am. So there are a lot of things which actually causes this problem in the peristaltic movement. Outlet obstruction, it can be due to the bad position for your using washroom. It can be like the position of your commode. It can be the squatting position. It can be due to the pelvic floor issue. It can be due to undiagnosed some rectal issues. Basically outlet obstruction. So both of this thing comes in primary, or what we majorly call functional constipation. Second is secondary constipation, and that is either due to the side effect of medicine, medical disorder, dietary issue, structural abnormality. Now, medication. We all know iron supplement causes constipation. There are certain drugs also which causes constipation. Why? I will discuss that later. But there are certain drugs. Now, why they are being classified in the secondary? Because we can't avoid them taking, right? We have to take them and we have to find out some bypass to get over it. Primary mein, like once we identify the cause, like there are again the bifurcations like SIBO and many others, we can directly work on the cause. But in secondary, we have to go with the bypass, with the side way. Medical disorder. For example, a person is diabetic. 70 to 80% of cases, many diabetic educators or seniors are also here, they will agree, have constipation. So there is a side effect of constipation and there is inbuilt constipation. So there also we have to make a bypass because diabetes is going to be there, or there is already thyroid. We all know that with excess of T3 in the body, there is a condition of constipation. Other medical disorders, acute conditions, any antibiotic is going on, or pregnancy may iron supplements are going on, constipation will be there, or structural abnormality like any blockage or hernia kind of thing. Next slide, ma'am. Now, here we will understand typical patterns of bowel movement. In a family, for example, if I take my family, in my family, I am there, my spouse is there, my daughter is there, my father-in-law is there, and my nanad is there. Me and my nanad are of almost same age, and my spouse also. But surprisingly, we three also have different pattern of our bowel movement. Like for me, I have to go to 2-3 times to get fresh in a day. For my nanad, it is once. For my spouse, it is maybe alternate, or maybe every day it is different. For my father-in-law, who is aged 70, for him, it is not clear at one go. Why? It is different in geriatric. Why it is different in geriatric? Because many nutrients are not well absorbed in the gut. And 90% of the feel-good hormone, that is serotonin, is produced in the gut. Tryptophan is the precursor of serotonin, and due to its deficiency or insufficiency, less amount of serotonin is produced, and that is why the regular peristaltic movement is slowed down in the geriatric population. What happened to the people who are of same age then? Other three factors, the sleep cycle. The sleep cycle is governed by melatonin. Again, the precursor is glutamate and tryptophan. SCFA is also responsible. So if you are not having a good 7 hours of sleep, then the body will not able to rewire itself or detoxicate itself. So definitely there will be a disturbance in the bowel. Stress level. As right now Jyoti ma'am says, the cortisol, when rises in the body goes into a fight and flight state, and there at times we have difficulty to pass out the stool. And why this, I will explain in the next slide, how the vagus nerve is beautifully connected with our gut to brain, and our brain signals our vagus nerve when to be happy. We have seen, like when we are very happy, like super happy mein to I don't feel like eating. Maybe my vagus nerve explains we don't need, we have enough storage. But medium happy mein we feel like to eat something. All our receptors are very active at that point. All of our neurotransmitters are very active at that time. So based on that, even in a family, there are different patterns. So assume for your patients, there is a lot of variation. And this is a Bristol stool scale I have taken from a research paper. You can refer the paper as well. And these are the typical shapes and structure of the stool types. Going to next slide, ma'am. As I just said, the vagus nerve, the longest nerve of our body, connected from hypothalamus to our gut via the spinal cord. Now assume you have a severe back pain and you are not having the willingness to have the same appetite to have your favorite plate of biryani. Very obvious, right? Because the sensory nerves are only not working. Assume the patient has come to your clinic, the patient is a diabetic having an antidepressant and he is diabetic since 20 years, having a lot of issues. Do you think he will have the same appetite? He is complaining to you, ma'am, I am not feeling that appetite to eat the meals properly. I don't feel fresh after coming from washroom. So what can be the treatment? Will be the treatment just to give a lot of fibers and push it? Now imagine the first thing which I just said in the start of my slide, that is, imagine the skeleton and the man. If I increase the speed of the staircase, the man will fall down. And if I keep pushing the man will face an accident. So I have to make a balance. Both should go hand in hand. This is the proper process. You can see in the diagram how the swallowing happens, and there is a chemical digestion before entering into the physical digestion, and that is the place where the neurotransmitters actually work. The crucial interplay of the feel-good hormones, cortisols, and other hormones takes place. Here is like this chemical digestion is the game changer for every criteria, whether it is a menopausal woman, whether it is a geriatric population, whether it is a pediatric population. Now you will say, what is the stress level in a pediatric population? Now I will come to that slide as well. So it is the game changer. Going to next slide. Yes, ma'am. Very important, interesting slide. Covered a lot of things in this one slide. So this is basically a slide who are very much working nowadays with the field of non-communicable diseases, starting from hypertension to cardiac issues to diabetes to nephro issues. So I am talking here about the inflammatory cytokines. What are they? The moment our stress level increases, our hypertension increases. The rate at which the blood flows throughout the system, it speeds up. Extra pressure gets put up in our kidney. Our kidney face difficulty to urinate. Not only this, due to the hypertension, we know the cardiac muscles also face trouble. Due to this hypertension, our hypothalamus nerve gets very scared and it signals, see, there is some extra glucose need because there is some extra work. Now, extra glucose need diabetic patients to understand. Diabetic patients are always hand up in eating the sugars and chocolates and the fried foods. Why diabetic? At every day, 7 p.m. in the evening, I think most of us feel like to go and have some pani puri or maybe some fried food items, right? So basically, when there is an inflow of this highly salty and processed food, we all know what happens. There is increase in the methylation of methyl SIBO, small intestinal bacteria, which causes the methyl gas increase in the intestine colon, and that creates a trouble in digestion and as well as evacuation. Apart from it, a different story is played by this TN alpha, IL-1 and IL-6. What are they? Since last decade, last 10 years, researchers have identified this inflammatory cytokines who are very much active whenever a new member comes in the class. Like there are some 4 or 5 members in our class also, now when we are in school, who gets very excited whenever a badmash bacha comes in the class. And they think, okay, let's take that person in the gang. So they are like that. So the moment we put a vada pav or the moment we take a fried item, it can be pakoda, it can be anything loaded with salt and free sugar, they are activated. The moment they are activated, they are going to hold your peristaltic movement. They are going to hamper your microflora. They are going to hamper your intestinal flora as well as your nerves of the gut. Next slide, ma'am. So before, no, ma'am. Yes. So before going to this slide, what can be the do's when we have this kind of conditions? First, the psychological counseling is required. The reason of explaining this thing is, ma'am, previous slide. Yes. The reason of explaining this is that the moment one feels that the gut is not working, I am not feeling fresh. Being a dietitian, I have to understand what is the stress level, what are the medication that person into, what is the comorbidity that person is having, so that I can understand the root cause behind the iceberg and not just superficially pushing with the fibers. Going to the systemic inflammation and low grade inflammation. So systemic inflammation is, it works in a system. I have to correct it with my dietary therapy from the roots, not superficially. I have to start working on the amino acids, on the saturated fatty acids, on the soluble insoluble fiber, both in the case of children and adult. And low grade inflammation is where the hamper is in a particular place, like in different sites of the colon. It can be IBS. The treatment can be done with the low FODMAP diet. It is very much well known in IBS, and low fermentable sugar food items we prescribe here. So dietary part, I am taking it in the remaining slides. Next slide, ma'am. Sorry. Excuse me for my cough. Pediatric constipation. So this is the Fijid model I have taken. This model is taken by the group of scientists. They have done this experiment in a mice model some 7 to 8 years back, and still the research is going on. So what they are saying, the most common problem when a pediatric patient come to our clinic is constipation. Now, mother always, every second they complain, my child is not evacuating, and they start there a lot of homemade remedies and techniques with the child. But before that, if we can just in a layman term explain them this Fiji chart, what is this basically? There is an early life reason or pathology, that is genetic and environment. For example, I am a person having a not very good bowel, same goes with my parents, and sure, ma'am. And same goes with my children as well. So if I expect my daughter will have a very good bowel, that is something I am not supposed to, because I have that genetics inbuilt, and same is carry forward in my daughter. Now you can say, then what is the role of diet? So diet will definitely induce the epigenomic effect. What is the epigenomic effect? So having the good foods and good lifestyle can definitely impact our genes, and they will rewire themselves. The psychological factors here I will not go much, because already ma'am have told, and she will cover further also regarding the stress, how the child's body. Now, child is a person or an age group where he or she is very much vulnerable towards the stress. The ADHD condition, the autism condition, all comes due to the sociological detachment thing. The child is lost completely in his own world, thinking nobody is there. I have to make a friend of mine, an imaginary friend, or maybe some psychological issue. He is caught in his own world. And hypothalamus nerve will not signal properly to have a proper bowel. Physiology, definitely, if there is some inflammation or gut bacterial issue, there will be issue with the evacuation of the bowel. Okay. So medications, doctor visits, daily function, these are definitely the outcomes. But then being a dietitian, our role is to make the things simpler, giving the right dietary advice. Next slide, ma'am. Talking about the dietary management in constipation. Next slide. First, coming to carbohydrates. Simple sugar. Till now, we have understood simple sugar are the villain. We will not talk about simple sugar in treating constipation, right? Because they are increasing our cytokinins, they are causing the inflammation, they are disturbing the gut flora. What we will talk about? We will talk about soluble and insoluble fiber. Soluble fiber, what does it do? It helps in producing the short chain fatty acid. As Jyoti ma'am also said, short chain fatty acid not only help to improve the gut flora, but also they help to improve the intestinal lining. Like we heard now, we should add ghee in our with our rice because ghee contains butyric acid. Now that actually helps to heal our intestinal lining, our microvilli. What does insoluble fiber do? They have helps to add bulk to the stool. They help to push that man in the skeleton, push that stool. Now understand the cause, and we have to give the therapy accordingly. Where it is a need of insoluble fiber, there is no means of adding soluble fiber to the diet. And when there is adding bulk to the stool, there is no means of adding soluble fiber to the diet. Going to next slide, ma'am. Okay, just a moment, the last slide. Here is one disclaimer. There are certain conditions where both the fibers will not work if there is any pelvic floor dysfunction. So that needs to be diagnosed properly while the patient comes to clinic with having the proper test report. Yes, ma'am. Next slide. Role of amino acids, very crucial. They help in the signaling pathway. Now in this slide I have talked about glutamine and tryptophan. Tryptophan, I have already told that it is the feel good hormones precursor, serotonin's precursor. And if tryptophan is not there, the signals sorry, will not pass properly to the hypothalamus to evacuate the bowel or to have the appetite. The ghrelin leptin hormone, responsible for feeling hungry and feeling full, they will also not act because they are very much related with this amino acid. Now glutamine, what does it do? As per researchers say, glutamine help to improve the cell turnover of the intestinal lining and also help to absorb the energy in the intestinal lining. So these two essential amino acids are always neglected whenever a person is going a low protein diet in constipation situation. We have to be focused what are the good sources, not in the constipated type but other type of high quality protein of good pedicaz value protein. Going to next slide, ma'am. L-carnitine helps in the gastric emptying. So that is the reason you will see in the post-workout meal nowadays in the exercise, the people prescribe L-carnitine. They not only help in gastric emptying, they help to muscle build also. They have to reduce the fat also and evacuate the toxins from the body very well. Asparagine. Sorry. Asparagine is a natural diuretic food. It is available in asparagus with the name as it implies, and other leafy vegetables also in trace amount. So adding every day some of the other leafy vegetable in the diet. If you are having a coronary CKD issue, you can definitely go for blanching, or else you can add directly some green leafy vegetable to get a natural diuretic in your diet. Next slide, ma'am. Now, the hormonal causes of constipation. So, as I'm just saying that the hormones play a key role, like the progesterone, estrogen. These two, if I talk about, especially before our menstrual cycle start, PMS time, people feel constipated. What is the major reason? Because the progesterone and estrogen level are going up and down. At that point of time, these hormones greatly influence our gut peristalsis. So if you are having a constipation, in place of going to a laxative, if we can have a just simple hot rice with a soybean curry. Soybean, we know, having the natural phytoestrogen, it can help in the evacuation because soybean is also a very good source of tryptophan. Stress hormones plays as cortisol I just told about. I will not take time covering this part. I will go to the next slide. Next slide, ma'am. Short chain fatty acid. The fat prescription. Now people have this notion fat are always the culprit in every situation. Fat ko hatao, fat we should remove from the diet. So it is not like that. Short chain fatty acids actually help to improve the oxygen level and improve the pH in the gut. Now imagine if you are having an acidic pH always in your stomach, will you be able to digest the best kind of diet in the world? No. So the pH should be at its proper point. Also the mucus lining, immunity of the colonic septum, and as well as the tightness of the colonic walls is very important, which is highly regulated by SCFA. Now short chain fatty acid is not only present in coconut oil, it is also available in whole grains, nuts, seeds. So they can be taken. Thank you, sir. This is the latest research which I have taken for all of you. This is the British, sorry.
1 কেজি কমিয়ে দিন 72 জ্যাকেট আর জিন্সে আপনার 1 কেজির মতো
Can I
So,
request everyone to mute your thing? Whoever is she, please mute yourself.
British Dietetic Association guidelines. So this research was presented, given in the start of 2025, but it was accepted and published in the open publication in October 2025. So what are they saying? They have come up with the guidelines with the following fruits and the supplements. Now be a little careful here. These are for the British people, for the US people, not for the Indians. So what I have done, I have gone and researched in the deep of these fruits, and I have found the alternative of this. First is kiwi fruit. Now kiwi is rich in astindin enzyme. Now, what does this enzyme do? Basically, they are saying that trouble creators are proteins. Protein causes constipation, right? It makes the stool more hard. Now, banana. Banana contains pectin. It helps to absorb the intestinal water. Papaya contains papain. Pineapple contains bromelain, and ginger contains gingerol. So all this help in the protein breakdown. So make sure when you are giving the prescription to a constipation patient, either of this thing is added in the prescription. So most of time I have seen dietitians diet chart, they give ginger water in the morning or maybe after the lunch. Because gingerol is there, it basically helps to break the protein. And even if you can also try this after a heavy Sunday lunch, after those mutton curry and rice, you can have this gingerol water and you will feel very fine in the evening. Apart from this, it is a very good prebiotic effect. So again, this 4 things provides the prebiotic effect. Next slide, ma'am. Prunes. Now, prunes I will never prescribe to any of my patients. She will come and make me run out of the clinic. So what I can suggest, apple and date. So apple, contains sorbitol. Sorbitol helps to lower the blood pressure and help as a natural diuretic. Additionally, dates also help because dates contain a lot of iron and important minerals like manganese, magnesium, which helps to improve the peristaltic movement. Next slide, ma'am. Rye bread. Basically, nowadays very famous in researches. Many of you have done your MSc dissertation also. Gluten-free. Gluten-free alternative. Gluten is responsible for creating irritation in our intestine. So what can be the alternative? So whole wheat, definitely it is gluten loaded. Anybody who is having a constipation but they are not sensitive to gluten, we can always ask them, bhai, go for a dal roti. Next, rice. Now, don't ask the patient to take brown rice. Why? Because brown rice, they have skeptical. Why I will go for a new thing? Ask them to take rice with vegetable. Why vegetable? Because vegetable contains folic acid and tryptophan. Again, very good for the peristaltic movement. Bajra and oats go for the rainy weather and for the weather when it is a comfortable temperature, because their thermogenic heat is very high and lot of calorie will require to break them down. Going to next slide, ma'am. Magnesium oxide supplement are very much popular in nutraceutical industry nowadays, but without giving magnesium oxide supplement, if we can ask our patient to go either for roasted seed, nuts, legumes, whole grain or dark chocolate, any of these three regularly throughout their life in good amount, definitely they will not have this deficiency. Because again, beside giving magnesium, they help in the, what is the role of magnesium? Muscle relaxation. If magnesium is there in your body, you will not crave for chocolate. You will see children crave for chocolate. Many ladies also crave for chocolate. Why? If they do their magnesium test, they will come up with magnesium deficiency. So this is the reason. Next slide, ma'am. So this is taken care by Jyoti ma'am. She will explain after having this healthy diet also what is the major role of the exercise and physical activity in maintaining the gut mobility. Handing over to Jyoti ma'am.
Thank you so much, Deblina ma'am. I won't take very long time. I would take few minutes from your pocket and from your things so that you can have a look that why, along with the dietary patterns which already in depth has been discussed by Deblina. Physical activity. Since our school days, since our, the time that we have started to walk, we have started to run, physical activity in some or the other form has a beneficial role in our daily life. Not only it improves our transit time, but the way we sit, the way we do different forms of the physical activity, it is actually helping in overall improving the motility as well, and also improves our overall well-being as well. There are different forms of the exercises in order to ease constipation. We have core exercises, we have yoga, we have walking or running, and as well as a little light cardio exercises. Now, in today's time, everyone loves to do yoga, like maybe some form of Surya Namaskar and all. So definitely that can be done. But we can do something more. There are beginner friendly yoga poses which can be really helpful for the constipation relief. Like early morning, instead of sitting just and having water, you can actually pose yourself in malasana position, and then you can have one glass of water at that time. That can be really helpful in that. Apart from that, there are different other poses like half lot of the fishes, which is called ardha matyandrasan, happy baby pose, child pose, pavan mukta asan, camel pose, and many more like that. Now, when we are talking about physical activity, and then when I at the beginning I talked about the stress, where it is like attached with like just roti kapda makan types. So yes, stress, mindfulness can actually need to be worked out, because we need to be also mindful enough if we want to reduce the stress. And in today's time, when it is like a talk of the stress, everyone is like, I'm so stressful, I am, मेरा इतना काम का प्रेशर बढ़ गया कि मैं आगे बढ़ ही
Jyoti,
नहीं पा रहा
ma'am,
हूँ.
I will gently remind you about to wrap up
Yeah,
a little
sure.
faster.
2 minutes. So it's like this key, because of this stressful condition today, because of that, we forget to eat properly. We forget to understand that if we are not eating well, the nutrient absorption, the inflammation is going to be little quite go in the heavy. So yes, for in order to understand this, say the researchers have come up with a triad which is called stress digestion mindfulness triad, which actually works on the nervous system, neuroendocrine, immune signaling, stress, as well as the mindfulness. because mindfulness is going to improve your this one, your motility. It is going to reduce your reduce the damage of the gut lining, and it's going to actually promote the rest and digest responses as well. So being mindful, you applying the techniques of mindful eating as well as several forms of the mindfulness, we can actually help us to overcome the stress, and in this way also the constipation. So with this I would conclude that let food be your medicine and fiber you be your friend for a gut that's happy and a body that transcends. By adopting a balanced diet, you can actually prioritize your gut health today and start feeling the positive impact on your overall being. Thank you so much. These are the references being used for this. Thank you.
So any questions is there? Otherwise, I can, it's a time shorting.
Yes, ma'am,
So,
we have
yeah,
a few
actually we
questions.
are, yeah. Any questions is there? Otherwise,
We'll take
actually this,
two questions from the top.
quickly can say one questions because it's at the time boundary. So only one
Yes.
questions we can get.
We have
Very
one
quickly.
question from Prachi Sayani. Gluten should be avoided only for gluten-sensitive enteropathy, diabetics, or others require its elimination as well. Why so?
So I would like to answer this. Gluten is something which, as per recent researches, it is a very interesting topic of research for me, and I do a lot of study on this. So basically, gluten contains a something opioid-like factor which creates that drowsiness in our mind. You will have that feeling after having those chapatis or fulka at your home. You will never have eating anything. So basically gluten is causing that, and that is the reason after having so many issues with gluten we are not able to remove gluten from our diet. But definitely gluten creates irritability in the bowel, and that is therefore it is very good or advisable if we can remove gluten from the diet and find gluten free alternatives.
Okay.
Right. Thank you
So
so
I
much.
can say thank you, Deblina, and thank you, Jyoti, because it's a very short time, but you guys explained very well. And at this end of the sessions, we realized this is the IPEN chapter, and we wanted to show the gratitude to this IPEN, because we hope in near future we can get more platform for discussions this kind of topics. And I would like to thank NEC National Executive Committee member Shangumitra ma'am, and I would like to show my gratitude chapter president Dr. Mahesh Chansari, and our vice president dietitian Ikshita ma'am, and chapter secretary dietitian Shudeshna ma'am. Thank you so much, ma'am, for giving us this opportunity, and hope in near future we will come back again with a new topic and a very interesting topic. And thank you all, and bye. Good night.
Thank you, everyone. Thank you.
Thank you, ma'am. Thank you, everyone.